Today I'll be presenting about meningitis, specifically viral meningitis. I'll be talking about modes of transmission, distinguishing characteristics of the pathogen and the disease caused by the pathogen, systems affected, symptoms and signs, long-term and short-term medical problems, treatments, and prevention methods. So, the main pathogen that causes meningitis would be enterovirus. Other causes are the herpes virus, mumps, HIV virus, and the West Nile virus. Viral meningitis is the inflammation of the membranes covering the brain and spinal cord. Modes of transmission for the enterovirus are through direct contact with an infected person or surface, presented in feces, saliva, mucus. The virus is very contagious and happens mostly during the summer and the fall seasons. Human systems affected. The main system would be the central nervous system, containing the brain and spinal cord. Inflammation of the meninges, which is the membrane around the brain and the spinal cord, and possibly all parts of the body, from the immune system to the endocrine system, even to the digestive system. So, what is the life cycle of the pathogen? The enterovirus isn't very long. It's usually 1 to 2 weeks, and the symptoms last about 5 to 7 days for the viral meningitis. But what are short-term and long-term medical problems that we should be worrying about? For long-term, they're more severe. You could have a learning disability, memory problems, visual impairments, auditory problems, and even more virus infections. Short-term, you might have a prolonged fever, seizures, large amounts of fluid buildup in the body, if not treated, even maybe a coma. So acute respiratory distress syndrome also is a fluid buildup in the lungs. So it's a lot of fluids that are building up in your body. Common causes, when we're talking about meningitis, not only are there viral infections, there could be chemical irritation, drug allergies, fungi, parasites, or tumors that may have caused symptoms. Common symptoms may occur in babies and adults, such as a fever, poor eating habits, sleepiness or trouble waking up, a lack of energy, or a stiff neck, specifically for adults, and maybe sensitivity to bright lights. And others occur, such as a headache, nausea, and vomiting. So keep in note that these initial symptoms are very similar to that of bacterial meningitis. However, bacterial meningitis is a lot more severe and can cause more serious complications such as brain damage, hearing loss, and learning disabilities. So how do you diagnose this? Well, if you're at home or even at the doctor, you can swab your nose and or throat. You're swabbing your rectum. So you can also take your blood, draw fluid from your spinal cord. So treatments. There aren't really any specific treatments for viral meningitis. Most people who get viral meningitis completely recover within 7 to 10 days. However, certain viruses such as the herpes virus and influenza will usually get better from treatments such as antiviral medicine. So antibiotics do not help viral infections, so they're not very useful. Some cases have shown that antiviral therapy has worked to improve the conditions of viral meningitis. But the best solution is bed rest, plenty of fluids, and over-the-counter pain relievers for fever and aches. How do you prevent this? Well, it's very simple. It's like preventing your common cold. You wash your hands often with soap and water. Avoid touching your face with unwashed hands. Avoid close contact with people who are infected. Cover your coughs, not with your hand or your arm, but with a tissue. Clean and disinfect frequently touched surfaces, and get vaccinations on schedule. And avoid bites from mosquitoes, that does not help, and other insects. And control mice and rats. Well, thank you for your time, sir. This has been a good interview.
Thank you.
Thank you.